Imagine you could step inside the minds of Canada's healthcare leaders, glimpse their greatest fears, strongest drivers, and what makes them tick. Welcome to Healthcare Changemakers, a podcast where we talk to those leaders about the joys and challenges of driving change in our complex and demanding healthcare organizations.
Hey listeners, I'm Michelle Holden, Communications and Marketing Lead at HIROC. I'm here today with my director, Philip de Souza. First, we wanted to thank you for taking the time to listen and follow our podcast, Healthcare Changemakers. It means the world to us. In the past few months, we've seen how healthcare providers and support staff have been the driving force, fighting for the health of Canadians. We're all so very grateful. That's why we've dedicated this special mini-series to those individuals. Over the past 5 episodes, we've sat down with frontline and support staff in long-term care, midwifery, health regions, and hospital settings. As communicators, Philip and I are really excited today to have with us a few members of the corporate communications team at the Ottawa Hospital. We have Bernie Etzinger, Chief Communications and Outreach Officer, Michaela Schreiter, Media Relations Officer, and Brooke Peloquin, Internal Communications Coordinator. Bernie, I'd love it if you could tell me about yourselves and your team and what you guys do at the Ottawa Hospital.
Sure. We're known as the corporate communications team at the Ottawa Hospital, and I guess I would describe ourselves as a small but mighty team that works to support one of the largest academic research centers in the country. We have over 1 million patient visits a year. We have 19 sites, 3 major campuses, and so to support the communication needs to reach the clinical community, our administrative support community, and the community at large. Our small and mighty team is about 7 people, and that covers the entire gamut of communication services, social media, internal communications, web, community engagement, and really a host of other functions over and above that, including media relations, which used to be everything that we did, and that was a component of what we did. So this small team was the one that was called into action early in 2020 once we came to grips with the situation that we were facing with the novel coronavirus.
Small but mighty. That's a great way to describe the team and the amount of work you do to support staff and the community. Brooke, can you tell us a bit about some of the internal tactics and communications that you've employed to support staff and develop trust around the pandemic?
One of the first things that we started doing was issuing an all-staff message from our CEO every day. And I think that made a really big difference for the people who were working from home. At one point, I was kind of collecting feedback from staff, and someone had said, it really means a lot to me that you're taking time out of your day to send these messages to staff because it makes me feel connected with the hospital, even though I'm not working there. So I think that kind of goes to show the impact that these messages had, but also internal communications and keeping staff feeling connected, even though we're not physically together. So that's something that we started up early on in the process, and that's something that we've continued. We've kind of changed the cadence because we don't necessarily need to issue one every single day, but they're still quite frequent. Oh my gosh, internal communications. We've been doing so much. We started to develop a massive FAQ just with any questions that staff might have, and it literally touches on any topic you could possibly think of. And we went on to develop kind of like a microsite on our on our intranet. And we definitely do it's a challenge reaching our clinical frontline staff and then also communicating with our administrative staff. So we have to look at multimedia ways to hit everyone. And this intranet site was kind of a way to present the information in a way that was digestible because we just had so much stuff coming at us from left, right, and center. And so this little intranet site we have multiple pages, but it's digestible. We have buttons. It's kind of recognizable and branded. So we have our FAQ living there, instructions on visitor policy that gets updated whenever we have changes, that kind of stuff. So it was kind of trying to figure out how do we take this massive amount of information we're getting and make it into something that's not overwhelming. And part of the question that we were asking ourselves at the beginning was, how do we get staff to understand that they can come to us for trustworthy information? because, at the beginning of the pandemic, there was just so much counter information out there, and we weren't sure. Like, even myself, I was like, what do I believe, and what is correct and what isn't? Just, there's so much information coming at us from all corners. And, this space, our internal communications, became a place where people knew they could come to for accurate information. It was up to date. And I think it really helped with making our staff feel safe too.
Absolutely. Thank you, Brooke. Staff morale and consistent messaging has been really important throughout this, something that we've seen at HIROC firsthand throughout all of this as well. Bernie, perhaps you and Michaela can speak to how it took shape on the outside in terms of connecting with the public and your partners in the region.
The other pieces that came up then was the support that was needed then to support the government's push to have assessment centers, for example. So we worked with a team of clinicians over 24 hours to stand up the first assessment center in Ontario, or the second. It was the first or second in Ontario, and to make sure that we could then take the media through that at that particular time to be able to tell that story, to be able to also not just reassure our staff, but now also to reassure the general population that that testing was taking place, that we were able to know who had who might be experiencing COVID, to be able to work with our public health partners. So that was one piece. I think the second piece was we brought our emergency response network into play. We have a great relationship with our public health authorities and also with the other hospitals in the region. And it quickly became clear that we would need to really act as one unit when it came to that, not separate hospitals giving separate messages. So really the idea that you could bring all of those voices together to speak to the million or so people that live here in Ottawa was also a key part of the strategy that we had in place. And then the third thing, which I think was really quite interesting, was really to link together how the community wanted to help and how we could help the community. And I'll sort of touch on two areas and then leave it to my colleagues to explain some of that in a bit more detail. One of the pieces was we had people who were, scaling up ventilator capacity. We had people who were 3D printing face shields. We had people who were beginning the research around this novel coronavirus to understand what it might be. Some of the best researchers in the world creating and tapping into networks, both for funding and then also to begin that research and to begin that massive collective effort. So telling that story meant you had a public that both wanted to thank these frontline providers and also to support them. So we launched a fund with our foundation partners as well. And then secondly, we made sure that what we were seeing across the city, there were these beautiful signs that people were making. We're all in it together. Kids were like, spending their afternoon thanking healthcare. We're sending in cards. And really it was our goal to make sure that kind of thanks was reflected back to our staff, because the morale piece was so important as well. So really you had the reassurance, you had the morale, and then you had that, what I would call completing that circle between the innovation and research that was necessary to go on. As our hospitals, started to empty, treat COVID patients, the curve was going up, and then as we flattened the curve and did all the things we're doing now, that was really the sort of core part of our effort in the corporate communication shop.
Was there anything, Michaela, that you'd wanted to add to that?
Wow, there's a lot I think that we've all learned throughout this experience, and I think that, we've touched on the regional collaboration that took place throughout it. I think that's something that we'll really take away from this and see that when it comes to whatever project you're working on, I mean, we function better as a region when we work together closely, right? Like a healthcare system is very intertwined. It's not just a hospital. A hospital is one part of a wider system. And I think working with our partners and collaborating with them very closely, regardless of the project, I think it only stands to benefit everybody, especially when it comes to my area of expertise is more on the external side of communication. So especially when it comes to informing the community and making sure that the public has the information they need, there's absolutely nothing. There's no downside, I guess, to working closely with our partners, whether it be hospitals, Ottawa Public Health, other healthcare organizations. I think we've learned a lot about the importance of collaboration, and also, within our team, I think we've learned a lot about what we're all capable of, and how quickly we can mobilize things, and how quickly we can stand up an assessment center. So I think there's so many lessons that we've learned from this experience that will help us going forward.
Brooke, as someone who works heavily in internal communications, I'd love to hear from you on what Bernie and Michaela have had to say about the work that's gone in so far to the communicating the pandemic, and also standing up the assessment center and working with partners. How does that play out for you, and can you walk us through some of those experiences?
We talked about the efforts that went towards standing up this assessment center, and I can kind of expand on that and talk about, it wasn't just communications that put so much work into getting this put together. It was a team effort across the hospital and across departments. So, our team helped out with putting language together for signage that was going into the assessment center, making sure staff were aware that this was getting built and put together and it was going to be staffed. But, in the 24 hours that it took to essentially stand up this assessment center, we had IT on site, putting in the infrastructure to access our health information system. They did that overnight. We had facilities involved, putting up signage for us so people could be directed through the facility, quickly, safely. We had graphics and printing all this signage for us. So it was a huge effort across the hospital to put this together, and it was really, really amazing to see. Just putting forward a unified voice across the region. We have meetings with hospitals essentially everywhere in our community just to make sure that we're communicating the same thing and reassuring people that we're all on the same note and we're taking care of our patients, we're taking care of our staff, and we're taking care of the community. So it's been a really incredible effort from a communications perspective, but just a teamwork perspective as well. I've worked with so many different people that I might not have outside of the pandemic. So, and I'm sure hospitals elsewhere have had like a similar experience in this sense.
So, having gone through this experience, and I know the pandemic isn't over, but and a lot has changed, as Brooke and Bernie have explained in terms of your strategy. What's one thing that you will take from this experience and use it going forward as you guys develop projects and initiatives in communications?
If I could, I'd like to build on a little bit of what Bernie said, and that, really is the role of our hospital, or any hospital really, in the public health sphere, which I think, in previous years, we may have viewed ourselves as a little siloed and we take care of what's in our hospital, and public health focuses on the general population. But this has really shifted our focus to see like how we all work together for the greater good of the population. And I think where that was really key for us was our relationship with the media. We've always had a fairly good relationship with our media partners, but that relationship, I think, was A, put to the test, and B, really solidified and built on during this pandemic, because we needed them to get the proper information out to the public at the right time. And of course, they needed us because they needed to tell these stories. They needed to provide their listeners and their viewers with information. And it became a really symbiotic relationship, if I'm using the word correctly, where we both saw how much we need each other. And I think that our relationships that we had already built with the media were very key there.
When a crisis like this hits, it really draws people to work together in ways that they didn't think was possible, right? And so, as I look ahead and see all of and it's more than just efficiency, right? It really is this idea that you have to do what it takes to deliver the care that the population needs, right? And so, who the institution is becomes less important as to what is required to deliver the service at hand. And as we look ahead, I think from our particular vantage point in communications, the question really is to avoid that temptation for institutions to see themselves strictly through an institutional lens, and to continue that focus on communicating as a unit, right, and speaking with one voice in the clarity that the healthcare system demands, even in non-COVID times. So as the pandemic, as we get used to living in this pandemic, and we believe that's a new normal, are these arrangements also part of that new normal? And as we communicate to people, can we continue to provide good, clear communications to people. I always think the two greatest challenges from our communications point of view is ambiguity and complacency, right? And how do we work with our public health partners to reduce both? And I'm not sure that there's no easy answer on that. And I think that's sort of a function of everyone's own personal bias towards what the COVID piece is. But I think if there was really two drivers for providing the best possible communications inside and outside of a hospital, it would be really to reduce both of those factors, be clear and be vigilant.
Your team really took on the role of connecting all the dots for all your stakeholders, whether it was the public health or in your organization or with the media, and that seemed to really I guess I heard it in all your voices. It seemed to really propel the team and just kind of bring you all together, like you said, to like make things happen. And that's why our team at HIROC noticed it. We're like, wow, like the communications that it's coming out of that your organization is like phenomenal, and that's why we wanted you guys to share your story so other subscribers could learn from you. Is there I guess those dots that you connected, is there any kind of special sauce that we should know about, and how we all can strive to connect the dots like how you guys did?
That's a very generous way of putting the question, Philip. But I think the most important part about that piece on connecting the dots for those stakeholders is really to see the issues, through their eyes and in their terms. So they were able to sort of understand why they should be a part of that, why they should be in and helping essentially in each of these different areas. So our immediate stakeholders, of course, were the communication shops in the other hospitals. But then we had a variety of other stakeholders internally. Our stakeholders were the various department heads, the various leaders of the different professional networks that we saw through the piece, and then of course the community, right? And as we went through the community, what was particularly helpful for that was, and again I alluded to this when we talked about things like how we did the shields, the face masks, the ventilator capacities, all of those different areas. For us, the biggest part was to be able to take what they were doing, reflect that back to them, and work to develop the narrative back out of the community that really galvanized the support for our frontline work, because that's what it was about in the bottom line.
It's fantastic. It's amazing.
From what it sounds like, you guys are busy with the pandemic and everything that's going on out there, but also in the middle of that, you were working to transition to a new CEO and Dr. Kitts retired. So I just wanted to kind of speak about what that was like for you.
So from an internal perspective, it was really interesting because Dr. Kitts had built a really great rapport with staff, sending these all staff messages with COVID updates and just general hospital updates almost every single day. So, I think for some staff, it might have been even scarier having him leave the hospital as our CEO and the transition to our new CEO, Cameron Love. But so we did a lot of planning on, how is our new CEO going to communicate with staff and continue these updates, but in his own voice, and what is his own voice, and how is he going to present to the community as well. So that required a lot of work and a lot of planning. But I think ultimately what we came to was, letting our new CEO kind of decide who he was authentically and how he wanted to communicate with staff and build trust. So we're actually, the transition went really, really well. But we're still doing planning now. Like, how do we further his internal communications in ways that are slightly different than Dr. Kitts's? So we're looking into more kind of multimedia platforms that our new CEO can connect with staff. So we're looking into videos and maybe social media. So we're kind of looking like these new technologies and these platforms will reach staff in a totally different way. And on top of that, I think too, just the farewell for Dr. Kitts was kind of bittersweet because, there was a lot of restrictions in place with COVID. So, we had planned on having a massive celebration to kind of send him off. So we really had to think of creative ways that we could say goodbye to Dr. Kitts. And we ended up, sending a survey to all of our staff to collect memories and photographs of photographs of Dr. Kitts with some of our staff, and we collected a lot of really great sentiments from staff for Dr. Kitts that he can take with him. And I think it was also a really great way to see into what staff valued in a CEO, and maybe that's something that our current CEO can kind of look to for qualities that he can portray as well. And something else that was organized, instead of a physical event, we had a recorded. Well, it was half physical, half virtual. But on Dr. Kitts' last day, we had staff line the hallway. Everybody was wearing masks. Everyone was physical distancing, and we clapped Dr. Kitts out of the building on his final day. And I participated virtually. And it was really, really sad to see him go, but he had such an impact, and I think he leaves a really great legacy for our new CEO, and the future of healthcare in Ottawa is really exciting now. And having the pandemic thrown into the mix of things definitely makes it interesting, and it's a new challenge for all of us, but it's also exciting. So it was definitely a lot of work, having to deal with the pandemic and kind of our regular communications, and then figuring out how do we transition our CEO and someone that staff trusted and introduce this newer person. Our current CEO worked with the hospital before, but how do we start to build up his rapport with staff and kind of establish him as someone they can trust and go to for information? So it was a really interesting transition, to say the least.
Yeah, and I'll just kind of add to that from an external standpoint. We had made the announcement that Dr. Kitts was going to retire last year, I believe in the summer of last year or just before, and it felt like we had all this time to get ready. And then we announced that Cameron Love was going to be the new CEO in January, and he was going to take over in June. And again, we felt like we had all of this time, and we had no idea what was coming in terms of what our lives would look like at that time. So it's interesting to think of, what we thought. It was kind of a lesson in, you kind of have to prepare for literally anything, even the things that you don't know, you can't even think about. But I think that, to Brooke's point, we thought of a lot of creative ways to send off Dr. Kitts and to bring in Cameron, and, having staff line the hallways and be able to say goodbye to him in a safe way, and being able to share. We broadcasted that video internally as well, so any staff who couldn't make it were able to see it. And then we also put it on social media, and that became our kind of unofficial farewell publicly to Dr. Kitts. Because from a media standpoint, Dr. Kitts he's a shy guy. He doesn't like talking about himself. And he wasn't too keen on doing interviews because he didn't want to make this as much about him. But what he did allow us to do was film that send off, and also record an interview with him for our podcast. So we have a podcast called On Call, the Ottawa Hospital podcast, and we sat down with him for about an hour and just talked to him about his career, about his vision coming into to this role of CEO, and his thoughts now that he was leaving, and kind of comparing and contrasting. And a lot of great, for a guy who doesn't love talking about himself, he's probably one of the greatest storytellers you'll ever hear. And he let us in on a few really good stories, including the fact that he at the most aspired to be the manager of the LCBO in Barry's Bay, and he was very excited about that when he was 18. And thanks to a guidance counselor and his mom, he got thrust into going to university against his will and ended up being a doctor. And we know where he went from there. So there's little things like that we got the opportunity to tell the story of as he was leaving. And that was a really great thing. And, we adapted as we went along. We certainly didn't anticipate what we were coming into and the world we'd be living in and the time constraints that we all had. But I think we made it work because we were adaptable, and it helps when you have a guy as friendly and welcoming as Dr. Kitts. And as for Cameron, we're still in that kind of transition publicly of what his plan is, and we're letting him get settled into the role a little bit before we do anything too public with the media. But it's ongoing. It's certainly been an interesting experience, to say the least.
Yeah, it's I know you spoke about the video and kind of the things that you were doing, and I from our side, on HIROC side, we saw it on Twitter, and even just working with Dr. Kitts in the past as an organization, it was an emotional video. So it was really nice to see kind of the way that you guys adapted to that and to the transition, which you're talking about as well, to Cameron. So we'll definitely have to get him on the podcast one day soon, maybe. And also check out your podcast, On Call Podcast. So that's really exciting to hear. I just want to say thank you for kind of joining us today and sharing a little bit about your team. This is one of the first times we've had a communications team join us, and I know Philip and I are pretty excited about that, to hear what work you've been doing and also just kind of different strategies that have worked and what's kind of being adjusted. So it's really fantastic to have you on, and thank you guys again for joining us today.
Thank you for listening. You can hear more of our interview on our website, HIROC.com. Follow us on Twitter at HIROC Group or email us at communications@HIROC.com. Healthcare Changemakers is recorded by Ellen Gardner and Philip D'Souza and produced by Podfly Productions for HIROC.com. Please rate us on iTunes.